Our name, Solidarity Bridge, says so much about who we are and what we do. We are approaching our work with a sense of mutuality and hoping to connect with the medical communities in both Bolivia and Paraguay.
One of the most important aspects of the mission is the surgical education and the teaching of medical staff.
We help to empower the local physicians and the local institutions to do what they best can do.
We are able to help those poor people who can't otherwise afford any of the basic surgeries that we're doing, but also helping the surgeons there, so that as we leave, we've left a little base of experience and knowledge to those surgeons, and those surgeons then can impart that to all the citizens of Bolivia.
Our work and our goal right now and into the future is sustainability. Our motto or slogan is to heal and empower in Latin America.
The United Nations has made it a priority that medical missions are to go actually educate and teach, not just go take care of patients.
One of the things that I find very unique about this organization, exceptional about this organization, is they have a keen ability to find out what the needs are of the country, of the landscape, and adapt those needs to help doctors there achieve better results.
It was really essential that we begin to bring pacemakers down to Bolivia, and we finally reached the right people in Medtronic, and a channel has been created to make possible these operations. And we are probably at around 1,500 operations.
Without the medical devices, we can't perform some of the operations that we do. You just can't bring those devices down and leave them there. You've got to teach the doctors down there how to use them safely.
If we get the right people with the right resources, there's no reason why people in Bolivia shouldn't enjoy the same amount of care as it pertains to their pancreas or to their liver or to their heart or to their brain that anybody else does. I mean, we are, and I think you'll find in this organization, we really feel like we're citizens of the world.
We absolutely have a medical focus to all of our work, and yet people of all walks are joining our effort. Financial supporters, volunteers in the office, event help, but also on our trips themselves. We have language interpreters, we have various allied medical professionals joining our efforts, so we are in no small manner a come one, come all organization.
What should compel people to reach beyond our boundaries is that we're one family, we're one human family. As much as we have limitations here and many needs, the needs there are even greater, and they don't have the access, to resources, to skills, to those things that we can get and provide in this country.
Despite the fact that there isn't a common language that you can share with them, they have ways of showing their gratitude. Whether it's knitting a scarf, whether it's making a basket, a necklace, or a bracelet, they find ways of giving back to you in the best way that they can.
The impact of the work of Solidarity Bridge is deep and wide. The patient who has the surgery has a restored family. This type of family that needs our services would have virtually no other access to the surgical care they need. So we are saving a life, restoring a family, and in a sense, edifying a community, and it's catching fire.
I'm Susan Noyes, founder of Make It Better, and we are pleased to give the 2014 Philanthropy Award for Social Justice to Solidarity Bridge. It sends medical teams and supplies to the poorest countries in South America. Volunteers perform complex surgeries and procedures and train local physicians to replicate those services. This strategy multiplies their efforts manyfold and greatly expands their impact.